Hi guys, Heather here. So there's probably a type of patient that everybody's kind of like a little apprehensive about taking care of when they're a new grad. Well, mine were respiratory patients. So when I would be getting a report in the morning and I see a diagnosis of respiratory failure on there, I'm like, oh my gosh, I can't take care of a respiratory patient. What if I need to give respiratory resuscitation or use an ambu bag, or what if they need a tracheostomy? Oh my gosh, please give me any other patient except a respiratory patient. I'll take 10 patients. I'll give up all my breaks. I'll take a comatose patient, a rude patient. I'll take any patient, but please, not a compromised respiratory patient. I was seriously playing that scenario in my head, but I never told anybody what I was really thinking. So one day I roll into work and I realize that I'm taking care of a trach patient, and I think to myself, this is awesome. Okay, think back to nursing school. There's a trach, and how do I clean it again? And then there's a suction catheter with a hole that you gotta put your thumb over to suction. How long do I suction for again? And oh, I'll figure it out. But I'm really thinking to myself, is there like a trach refresher course I can take real quick before I start my shift? So everything was going pretty smooth that day, no problems. And then in the afternoon, my patient walks out of his room like coughing on his secretions and pointing to his throat, and it was almost like a charades game because nobody's talking, and I kind of guessed that he wanted to be suctioned. And I'm thinking to myself, why does this patient know how to suction himself? He can walk out of the room and point to his throat. Okay, I'll be brave. It's my job. I'll do it. So I go in there and I pretend I know what I'm doing, and I suction him, and he's coughing and turning beet red. But he feels better because I got the secretions out, and I feel better because he didn't turn blue and I didn't have to do any respiratory resuscitation or anything. So one reason why I really don't like suctioning is because I don't like watching the patients like choking and gagging and turning beet red. But I gotta tell myself, Heather, you're helping these patients because you're getting the secretions out that they would be choking on anyways, and you're giving them a patent airway. Yep, that's what I gotta tell myself. So that's what helps me to put a catheter down someone's trachea. So the next time that you're kind of apprehensive about taking care of certain patients, just think about the good that you're doing for them, okay? All right, thanks for watching. Have a good day, okay? Bye.